Hey everyone, welcome back to my story Living with Lupus. If you're new here, my name is Susan Hendricks, and I share important information about living with chronic illness, especially lupus. Today we're diving deep into Discoid lupus, a type of lupus that primarily affects the skin. We'll cover what it is, who it affects, the signs and symptoms, treatment options, and things you should avoid if you have it. So make sure to stick around. And if you find this video helpful, don't forget to like, subscribe, and hit that notification bell. Let's start with the basics. Discoid Lupus Erythematosus, or DLE, is a chronic autoimmune condition that primarily affects the skin. Unlike systemic lupus erythematosus, which can affect multiple organs, DLE mainly causes red, scaly, disc-shaped patches that can lead to permanent scarring if untreated. These lesions typically appear on the face, scalp, ears, and sometimes the neck or hands, areas exposed to the sun. DLE is not contagious, but it is an autoimmune disorder, meaning your body's immune system mistakenly attacks healthy skin cells. While the exact cause is unknown, genetic and environmental factors, such as sun exposure and certain medications, may play a role. According to the Lupus Foundation of America, about 2/3 of people with lupus will experience some form of skin-related symptoms, and discoid lupus accounts for about 10% of all lupus cases. While anyone can get it, research shows it's more common in women, African Americans, and people aged 20 to 50. Now let's talk about the signs and symptoms of discoid lupus. The most common symptoms include red, inflamed, scaly patches. These can develop anywhere but are most common on the face and scalp. Hair loss, also known as alopecia. If the lesions appear on the scalp, they can damage hair follicles, leading to permanent hair loss. Skin discoloration. As lesions heal, they may leave dark or light patches, known as hyperpigmentation or hypopigmentation. Scarring and thinning skin. If untreated, lesions can become deep and cause permanent scars. And photosensitivity. Many people with discoid lupus find that their skin flares up when exposed to UV rays from the sun or indoor lighting. If you notice any of these symptoms, it's important to see a dermatologist or rheumatologist as soon as possible for diagnosis and treatment. So, how is discoid lupus diagnosed? Doctors typically perform a skin biopsy. A small sample of skin is taken and examined under a microscope. Blood tests to check for lupus-related antibodies. A physical examination to assess the location and severity of lesions. Treatment options. Since DLE is chronic and can be triggered by different factors, treatment focuses on managing symptoms and preventing flares. Here are the most common treatments. Topical corticosteroids. These help reduce inflammation and are often the first line of treatment. Calcineurin inhibitors like tacrolimus or pimecrolimus. These are steroid-free options that help reduce immune response in the skin. Anti-malarial medications, such as hydroxychloroquine. These are commonly prescribed for long-term management because they can help reduce skin inflammation and prevent new lesions. Immunosuppressants like methotrexate, mycophenolate mofetil, or azathioprine, used for severe cases where topical treatments aren't enough. Laser therapy. In some cases, dermatologists may recommend laser treatment to reduce pigmentation changes and scars. It's important to work with your doctor to find the best treatment plan for you and monitor any side effects, especially with long-term medication use. If you have discoid lupus, avoiding triggers is key to preventing flare-ups. Here's what you should avoid. Sun exposure UV rays can worsen discoid lupus, so always wear broad-spectrum sunscreen with SPF 50 or higher protective clothing, and hats when going outside. Smoking. Smoking can worsen symptoms and slow down skin healing. If you smoke, consider talking to a doctor about quitting. Certain medications. Some drugs like sulfa antibiotics and certain blood pressure medications can trigger or worsen lupus symptoms. Always check with your doctor before starting new medications. Stress and lack of sleep. High stress levels can cause flares, so practice relaxation techniques like meditation, yoga, or deep breathing. Harsh skincare products. Avoid alcohol-based toners, harsh exfoliants, and scented products that can irritate sensitive skin. Use gentle, fragrance-free moisturizers instead. That's a wrap on today's video. Discoid lupus may not have a cure, but with the right treatment and lifestyle adjustments, it can be managed effectively. If you found this video helpful, please give it a thumbs up, share it with others, and subscribe for more lupus-related content. Also, I'd love to hear from you. If you have discoid lupus, what has helped you manage it? Drop your experiences and questions in the comments below. Thanks for watching, and until next time, stay informed and take care. And remember, help us to reach 500 followers.